Reports of behavior and mental health issues in our schools have seen a dramatic increase following the pandemic.
Today, we learned that the statewide Safe to Tell reporting program for possible safety issues in schools saw an 89% increase in the month of September. Parents are also telling our school districts that their young kids are experiencing more conflicts in the classroom.
As Denver 7's Rob Harris shows us, mental health experts warn we will be seeing the effects of the pandemic for years to come.
As adults, we think that maybe children aren't aware of this, but children can be aware of this at a very primal and, an energy level.
Dr. Tiamo Kitsango-Piri is just one of several childhood psychologists who tell us the stresses of the pandemic and the world around us are having profound effects on our kids.
They understand that there's a level of stress in the family, there's a level of stress in the adults taking care of them. So all of these things, they won't know how to verbalize, and this is why we see them act out.
The impacts of the pandemic on our students' well-being are being intensely felt, not only here at home, but across the country. Check out these numbers from the National Center of Education Statistics. 87% of public schools reported negative impacts to students' socio-emotional development from the pandemic in the last school year. Nearly half reported rowdiness outside of the classroom and acts of disrespect toward teachers and staff. And more than half saw an increase in classroom disruptions caused by student behavior.
They might yell at their friends, they might, hurt or poke their friends or do these things that are, disruptive and just really acting out behaviors in order to communicate to the outside world what they're feeling on the inside.
Dr. Kitsango-Piri says our students have missed out on important life lessons and opportunities, especially our youngest kids, who weren't able to meet others their age and learn how to interact outside of their families. She says a good place to start now is showing patience and modeling some of those missed lessons for them.
Parents really can and should lead by example, maybe helping them brainstorm ways that they can cope with it, how they can take care of themselves, who they can talk to. When you have these big feelings, who do you think is a good person that you can talk to? And then helping them figure those things out together.
For Denver 7, I'm Rob Harris.
A lot to think about there. Now let's give some more context to the issues kids are facing. According to the CDC, between 2016 and 2019, nearly 6 million children were diagnosed with anxiety and nearly 3 million were diagnosed with depression. Since 2016, the U.S. Preventative Services Task Force has urged screening for depression in kids 12 and older. Now it's being recommended kids age 8 and older get screened for anxiety. Those recommendations apply to children who don't have a diagnosed mental health condition and who are not showing recognized symptoms of anxiety or depression. The task force says the screenings should help primary care doctors identify conditions early on so children and teens can get the care they need as soon as possible.